KEA Tutorials presents a gastrointestinal disorder, cholecystitis. Cholecystitis is the inflammation of the structure which releases bile, the gallbladder. Factors that increase your chances of developing cholecystitis are 1. Gallstones. These are hard particles that develop in your gallbladder. 2. History. If you have a history of gallstones or a past medical history of cholecystitis, this might prone you to developing this condition. And 3. Diet. Diets high in fat and low in fiber may increase the risk of gallstones. The causes of this condition are 1. Gallstones. Most often, cholecystitis is the result of hard particles that develop in your gallbladder. Gallstones can block the cystic duct, which is the tube through which bile flows when it leaves the gallbladder. Bile builds up in the gallbladder, causing inflammation. 2. Tumors. A tumor may prevent bile from draining out of your gallbladder properly. This causes bile buildup that can lead to cholecystitis. 3. Bile duct blockage. Stones or thickened bile and tiny particles can block the bile duct and lead to cholecystitis. Kinking or scarring of the bile ducts can also cause blockage. 4. Infection. AIDS and certain viral infections can trigger gallbladder inflammation. Signs and symptoms of cholecystitis may include severe pain in your upper right or center abdomen, pain that spreads to your right shoulder or back, tenderness over your abdomen when it's touched, nausea, vomiting, and some fever. These symptoms often occur after a meal, particularly a large or fatty one. Diagnosis. In diagnosing cholecystitis, your health care provider will likely do a physical exam and discuss your symptoms and medical history. Tests and procedures used to diagnose cholecystitis include 1. Blood tests. Your health care provider may order blood tests to look for signs of an infection or signs of gallbladder problems. 2. Imaging tests that show your gallbladder. Abdominal ultrasound, endoscopic ultrasound, CT scan or magnetic resonance cholangiopancreatography (MRCP) can be used to create pictures of your gallbladder and bile ducts. These pictures may show signs of cholecystitis or stones in the bile ducts and gallbladder. 3. A scan that shows the movement of bile through your body. A hepatobiliary immunodiacetic acid scan. Scan tracks the production and flow of bile from your liver to your small intestine. A HEDA scan involves injecting a radioactive dye into your body, which attaches to bile-producing cells. During the scan, the dye can be seen as it travels with the bile through the bile ducts. This can show any blockages. The treatment of cholecystitis involves both a medical and a surgical approaches. Under the medical approach, we have procedures like fasting. You may not be allowed to eat or drink at first in order to take stress off your inflamed gallbladder. IV rehydration. This treatment helps prevent dehydration. Some medication classes like antibiotics to fight infection. If your gallbladder is infected, your provider likely will recommend antibiotics. Analgesics. These can help control pain until the inflammation in your gallbladder is relieved. Antipyretics. To counteract the slight increase in temperature, which comes as a result of the inflammation. Anti-inflammatory medications. To relieve from the symptoms of inflammation. When medications can't take care of this pathology, surgery might be a good alternative. Surgical procedures like ERCP and a laparoscopic cholecystectomy. Under the surgical management of this condition, we have 1. and endoscopic retrograde cholangiopancreatography, abbreviated ERCP. During this procedure, dye is used to highlight the bile ducts, making the stones visible and therefore guiding the surgeon in surgically removing the stones blocking the bile ducts or cystic duct. 2. A laparoscopic cholecystectomy, which is surgery to remove the gallbladder using laparoscopic equipments. In order to prevent this condition, recommendations for the patient are: 1. Losing weight slowly. Rapid weight loss can increase the risk of gallstones. 2. Maintaining a healthy weight. Being overweight makes you more likely to develop gallstones. To achieve a healthy weight, reduce calories and increase your physical activity. Maintain a healthy weight by continuing to eat well and exercise. 3. Choosing a healthy diet. Diets high in fat and low in fiber may increase the risk of gallstones. To lower your risk, choose a diet high in fruits, vegetables and whole grains. Thanks for watching. Don't forget to like and smash the notification icon, so that YouTube can keep you updated with our activities.